Hi, I am Dr. Marty Ross. I am an orthopedic surgeon working with Rome Orthopedics and Sports Medicine. And today I would just like to touch upon some very common themes that we see in orthopedics. One of the common questions that's brought to me is, when do I need to see a physician for this problem? When do I need to go to the emergency room? When is it urgent? When can it wait? When can I just treat it myself with simple first aid? Most of the time, the minor strains, sprains, and overdo it type of injuries do very well with the simple RICE treatment: rest, ice, compression, and elevation. There's an old wives' tale about, with an injury, if you can move that part, it's not broken. Don't believe it. I've seen too many broken arms, legs, ankles, feet, hands, where they were moving just fine, but still the bone was broken. The simplest rules of thumb are, if it's just a little sore, a little achy, and they're ice, and certainly if you can take the over-the-counter medications, that should see you through. If you've had a twist, a fall, something hits you hard enough to make you know you've got hurt, then you have to sort of pay attention and look for things like swelling, break in the skin. Tenderness on the bone itself is usually a sign that something more has happened. And very often in those situations, an X-ray would be helpful. If the over-the-counter medication doesn't seem to give you enough relief, then it would make sense to give us a call.